So I have no conflict of interest to declare. So the goal of my presentation is to introduce different stimulation, chemogenetics, and also their applications in the preclinical fMRI field. I would also like to discuss the pros and cons as well as the do's and don'ts with these techniques. And also lastly, I'll share my own experience regarding how to get these experiments started in your own laboratory. So electrical deep brain stimulation, or DBS, is a very well-established neurosurgical therapy for many neurological and psychiatric disorders. In human patients, an electrode is typically implanted into the deep brain nucleus, and then high-frequency stimulation is usually given through a subcutaneous-like pacemaker stimulation device. So it is most commonly used to treat disease such as Parkinson's disease, usually when the medical therapies becomes inadequate or dyskinesia becomes intolerable. And when we use that for symptomatic Parkinson's disease, the subthalamic nucleus or the internal scopus pallidus are the frequent target. And this will usually result in a marked reduction of resting tremor and rigidity. So this video on the side shows you a patient with Parkinson's disease and having the DBS electrode implanted to the STN. And the clinician on the side just turned off this stimulation device remotely. And as you can see, the tremors comes back. And it's so severe that the patient cannot even hold and maintain a normal posture. And now you can see that the clinician is turning the stimulation device back on. And just in a few seconds, what you'll see is that the tremor starts to go away, and then the patient has an almost complete recovery from this desperating motor deficit. And you can do a high five with the doctor on the side. So what are the strengths of combining deep brain stimulation and fMRI? First, of course, is the translational opportunity. Despite deep brain stimulation has been increasingly used in the clinic, the circuit mechanism underlying the therapeutic effect of DBS are still very poorly understood. And fMRI just happened to be an ideal tool that gives you brain-wide circuit mapping, so it can help us to really better understand what DBS does. And second, DBS gives you high throughput mapping of the circuitry. In my opinion, the entry risk is very low compared to approaches such as optogenetics, because you don't really need to express those absence with virals or genetic animal model approach. You can just take the animal subject and wild type subject and then put in electrodes, and you can start your experiment right away. When you use this technique to map the brain circuit, the experiment can also be very high throughput, which I'll talk about it a little later with the applications of multi-channel electroarray. And also another strength of DBS is that it gives you high fidelity or high frequency neuromodulation. So if you are considering techniques such as optogenetics, if you use a routine, standard channel adoptions, it usually gives you 40 hertz capped of the modulation frequency. And if you pick some of the high fidelity options such as Cheetah or Chronos or Chief, you might be able to drive it up to 80 hertz top. And these are still well below the therapeutic frequency that are typically used in the clinic. So the disadvantages of the DBS is very clear. Obviously, we shouldn't risk a safety for the human or animal subjects without careful consideration of SAR, because repeated high-power RF pulses can actually create a very bad thermal damage. So this picture is from a case report paper in neurosurgery in year 2005. The patient has electrode implant to the STN and then went on for a lumbar spinal cord examination. And unfortunately, after the MR scan, the patient actually suffered from a permanent neurological deficit, including the lost ability to speak and also hemiparesis. And the follow-up MR image looks like this. You have a grapefruit size of lesion and hemorrhage close to the electrode. So we need to be very careful in terms of evaluating the equipment going into the room. So the second issue is also very well known. It gives you susceptibility artifact. And with very few exceptions, DBS technique usually use metal-based electrodes. And as you can see, these images are from a paper from our lab that we put in a tungsten microwires, which a pair of it is about 60 micron, but it gives you about 2 millimeter size of artifact, which preclude you from visualizing anything around this implant track. And also, it doesn't give you any specificity, as you know from the previous presentation, that DBS could create a field of modulation, and it can affect multiple cell types in a given volume. And also, it has no directionality, so it will fire both the incoming and outgoing axons at once. So how to get these experiments started in your own lab? There are many available electrodes in the market that you can consider. If you happen to be interested in making an electrode of your own, we have our lab had this paper in MRM a couple years back that we took a pair of tungsten micro wires, put it into the silver tubing, and then put in the plastic connector. You can use this very simplified type of electrode and very cost-efficient type of electrode to do simultaneous DBS and fMRI. And just in case if you're not familiar with the rodent brain surgery, we also have a paper on this Jove video that shows how we perform the brain stimulation experiment at that time. So basically, we first tried to expose the skull and then use the scalpel to roughen the skull surface so the dental semen can bind a little bit better afterwards. And then we'll try to stop the bleeding if necessary, and then locate the position of the bregma. And after that, we use a small dental drill to create a small cranial opening. And then we use a needle to open the dura. And depending on how long you want to hold this brain implant on the head, we typically put 1 to 3 screws. And these are actually MR-compatible metal screws that you can put in. And after that, we'll put an electrode and then start to apply dental cement. And when the cement dries out, you can bend it after and then put on more cement to hold your electrode on the head. And if you're looking for the first proof of concept study in your lab, what I would recommend is a paper that we have in brain stimulation in 2014, where we picked the area ventral posterior medial thalamus, which was covered by the previous presentation as well. And this area is known as the whisker thalamus. As we are all aware, rodents are really the whisker animals, and they have a huge barrel cortex. So this, for this particular reason, this pathway serves as a great in vivo phantom for us to test the model system. So what we did is a very simple and straightforward, put an electrode targeting VPN, and following stimulation, you'll be able to get a pretty robust increases in ball response, especially in the barocortical area. And interestingly, what we found is that when we inject the currents at very low frequency, like a 1 to 3 hertz, in our case, we got little to no responses. And the response start to peak around 20, 25 hertz and drop again at 40 hertz. So since we got sufficient contrast to noise ratio, we can do a bold versus frequency plot. And as you can see here, we can get a frequency tuning curve that look like this. And the specific parameters that I would recommend for you to start is to stimulate around 20 hertz and use a 0.05 millisecond pulse duration for your DBS. And our lab tried to take another step further to build an MR-compatible electrode array. And if you're interested in using this tool, please feel free to contact me. We're more than happy to share the technology. Basically, the array was made by polyimide as the base substrate, and the contact leads were made by gold, and we have 16 channels here. And we also spent a lot of effort on optimizing the material used for this plastic connector and the circuit board. So if you put the whole thing into agar gel phantom and scan with MR, this is what you'll see. With now the connector part and the circuit board and down to the electrode portion. This scale bar on the corner indicates 1 millimeter, and as you can see, there's really not much difference between the spin echo and grain echo images. The dark spot in the middle is the physical space that the electrode occupied. And this probe is good for chronic applications. We did put in this electrode to the animal brain and record the electrical impedance throughout 50 days. And as you can see, the impedance ranges between 0.2 to 0.3 mega ohm. So this is a great range for you to do electrophysiological recording. And also we can get a very stable sensory evoked potential throughout 50 days. Another hallmark of this probe is that this is highly bendable. So if you use a forceps to grab it and hit on the table, you'll see that this probe can be bended for more than 90 degrees. And this happened to be very useful for MR because you can put it in and flip the connected portion. And with that, you can use any type of coil housing to optimize your MR signal-to-noise ratio. So inside the MRI, the images look like this. The first things that we notice is that compared to some of the commercially available products, although the electrodes are about the same size, with our probe, we got pretty much negligible accessibility artifact. And this actually allows us to visualize what happened at the stimulation location. So when we try to pass the bipolar stimulation between the deepest two channel pair, channel 1 and 2, we can actually get this little negative bulb responses located at the tip of the electrode. And then we can start to stimulate the higher channel pairs. So now we're stimulating channel 3 and 4, 5 and 6, all the way up to between channel 15 and 16. And what you'll see is that this blue dot also moves up slowly. So the vertical range between this negative signal here and this yellow dashed line is actually the range that we have 16 contact leads of the placement. So with that, you can create hundreds of combinations to modulate the volume differently. So just to give you an example, the projected activation actually look like this. When we stimulate channel 11 and 12, we got the activation closest to the S2 area or the insula area of the rat brain. And when we stimulate between channel 13 and 14, now we get to the thalamic area sending fiber to the S1 of the hind limb region. And just another 75 micron above, now we get into the thalamic region sending projection to the barrel cortex. So this really highlights that you can combine this tool to do high throughput circuit mapping, and now we can map functional somatotopic organization even at a subnucleus resolution. So just to give you another example about how this could be used to look at the circuit connectivity. So this is a little resting state video, and what we did here is that we have the seed region placed in the cortical area, and with every additional second of the data, we try to generate a seed-based connectivity map. And as you can see, with about 300 seconds of the data, now we have enough power to depict this bilateral sensory motor connectivity, which is very well documented in the rodent brain. And this animal happens to have an electrode going to its VPM thalamus. So what we're doing next is that just in a few seconds, we start to stimulate this thalamic area continuously. And as you can see here, now with the same analysis on the same animal subject, the connectivity pattern is very different. Now we're depicting the patterns spatially locked to this thalamic stimulation area and the cortical site. So this really shows that we can use functional connectivity MRI to map these brain modulation effects. So this year in ISMRM, there are several interesting talks related to DBS and fMRI applications. So on Monday, Lichtal and colleagues from CMRR will talk about their work on detecting orientation selective DBS using BOLD. And in the afternoon, they talk about their study using multi-band SWIFT to look at the DBS effects. And Abby Lin from Victor Song's lab will talk about how they use microstimulation in the mouse cortex and use diffusion fMRI to examine the changes in corpus callosum, and the talk will be in the Tuesday afternoon. And on Thursday, Sun-Ho Lee from my lab will talk about on and off target DBS at STN. And after that, Takahashi and colleagues will talk about their DBS fMRI study in monkey. And other than these oral presentations, there are several incredibly interesting poster and e-poster, and the numbers are listed here. I'm sure that you'll be interested in talking to the authors in person. So now I'm going to switch the gear a little bit to talk about chemogenetics. Chemogenetics has been defined as a method that uses engineering protein to that are previously unrecognized of a small molecules. So you can use these small molecules or chemical actuator to actually stimulate these genetic and engineered receptors. So as you learned from the previous two talks, that With optogenetics, you need to use light to actually drive these ion channels or pumps. And you can kind of consider chemogenetics as a chemical version or a pharmacological version of optogenetics. In this case, you don't actually need light to drive the genetically defined cell type, but you just need to use an external chemical ligand to stimulate them. So oftentimes you'll hear a term called DREADS, and this stands for designer receptor exclusively activated by the designer drugs. And this is the third generation of chemogenetics that use the genetic mutation of muscarinic acetylcholine or kappa opioid G protein coupled receptors that have very high affinity to the specific ligand that are physiologically inert. So the most widely used DREADs are the HM3DQ, or so-called the GQ DREAD, and you can use that to enhance the neuronal firing via the intracellular calcium dumping mechanism. And there's another class of DREAD that allows you to do the inhibition, which is HM4DI, or so-called the GI DREAD, as well as the core DREAD. And the mechanism is through the potassium channel-related hyperpolarization and or inhibition of presynaptic neurotransmitter dumping. And the common activators or lighters or the ligands are clozapine N oxide, also called the CNO. You can use that to stimulate the GQ or the GI DREAD. And another line is the salvinorin B or cell B, which you can use it to stimulate the core DREAD. So the advantage of DREAD is very similar to optogenetics. It gives you cell type specific neuromodulation. So as shown in this cartoon, you can inject the virus to the cell body, and after the viral expression, you can have these DREAD receptors expressed on all the way to the axon and the terminal. And then with a single dose injection of the DREAD ligand, you can activate this specific group of the cells. And you can also achieve projection-specific manipulation by combining retrograde Cre virus with the Cre-dependent virus. So for example, you can inject a double flux virus to the cell body, and then inject the retrograde Cre virus to, in this case, olfactory bulb. And there are several retrograde Cre viruses available, such as the CAV Cre or the RAV2 retro Cre, which in this case, you express specifically these group of neurons projecting to the olfactory bulb. So with the systemic injection of the DREAD ligand, you can activate this circuit specifically. And also, you can do a intracranial microinfusion to achieve the projection-specific manipulation. So in this case, you can inject the virus to the cell body, similar to the case A, but then you put in another cannula to locally inject the ligands, such as CNO. So then in this case, you only activate this olfactory projecting terminals, but not the ones to the prefrontal cortex. So the example that I really like is a talk given by Rick Dickhausen's lab last year in ISMRM, where they took the CAV2 Cre virus, inject that to the accumbens, and in another group, they inject that to the medial prefrontal cortex, and then they have the Cre-dependent virus encoding HM3DQ going to the VTA. And in this case, they can actually label the VTA accumbens projection and then the VTA PFC projection, and then they indeed found a very different activation pattern with MR. With DREAD, you can also achieve multiplexed or bidirectional modulation. So for example, if you want to activate one circuit using GQ DREAD and suppress another circuit in the same animal subject using core DREAD, it is possible. You can also inhibit two separate circuits with DREAD. So you can first use the GI DREAD to inhibit one circuit and use core DREAD with cell B to suppress another. And of course, you can always combine with optogenetics to create more varieties of neuromodulation. Another strength for DREAD is that this is non-invasive because you no longer need a brain implant or any hardware on the head. And also, transgenic mouse lines have been recently developed, so you don't really need any surgery to express DREADs on a specific group of the cells. And with these in combination with the strength of having a prolonged control of cellular activity, this really makes DREADS having a much better translational opportunity compared to optogenetics. We know for a fact that signaling through DREAD is much slower compared to most of the other neuromodulation, and this kind of provide an advantage because in the case that we're taking pills to treat many of the neurological and psychiatric disorders, we know many of these drugs actually act through the G-protein couple receptor mechanism. So in this case, DREAD can actually provide the opportunity to stimulate a specific pathway without giving the much of the side effect. So this is a crucial point for the future translational opportunity. So the disadvantages of DREADS is that the potential changes of basal activity could occur because these G-protein couple receptors has many ligand dependent or independent states, so they could stay fully inactive or partially active or fully active even without a chemical stimulation. So if you express a lot of these receptors in the cells, you could change their basal firing pattern or basal activity. Also, it has been reported that with multiple dosing, desensitization of the receptors or receptor downregulation could occur in some of the animal models. And another one is that very similar to the typical pharmacological MRI, you only got one shot. So in most of the experiments, you might have to take a long period of time to settle the animal, but after you inject the DREAD ligands, all you can do is just wait and continue to acquire the data. So this makes the rapid control of activity very challenging, and which is kind of preferred for a lot of fMRI studies. So another potential issue with DREAD is that both CNO and cell B could have some side effects because CNO can back metabolizes to clozapine, and clozapine actually display a lot of agonist-antagonist affinity to the receptors shown in this figure here. And also cell B retains a modest affinity to kappa opioid receptors. So taking together with these two, appropriate control experiments is actually very important for chemogenetic fMRI study. So if you want to start doing DREAD study in your lab, my first recommendation is to read this paper titled DREADS for Neuroscientists. This was published in February this year in Neuron by the author Dr. Brian Voss, who's the inventor of the DREAD. And this paper has a lot of background information which you will need to do the chemogenetic study. Another thing that I would recommend is to look at the DREAD wiki page, and you can simply find this page by searching DREAD and wiki in your Google bar. And this page has a lot of information regarding the available viral constructs, animal mouse line, or rat or mouse lines, and also the useful review papers related to DREAD. And also lastly, there's a DREAD user blog maintained by the developer of the DREAD, Brian Ross. And this blog has a lot of information regarding the latest applications of DREAD on the high-profile journals, and also some technical discussions regarding how to use DREAD properly. So on the hands-on level, the first things that I would recommend is similar to optogenetics, you have to validate your expression. Even though we have these genetic tools and sometimes animal models, nothing really gives you 100%. So we need to look at the on-target and off-target cell types to make sure that the data interpretation is appropriate. And also control experiments, as discussed before, is very important for DREAD studies. It has been reported that the CNO dose ranging from 0.1 to 3 milligram per kilogram is typically useful to stimulate the DREAD receptors, but won't affect the behavior of naive animals. And the dose reported for cell B is 1 to 10 milligram per kilogram. However, important thing is that how these doses will affect fMRI signal remains to be an area that we need to study more. And in my opinion, it is very important for us to look at the dose response curve in a specific model system that we're studying, and always try to use the lowest effective dose possible to avoid the unwanted side effects. So if you're looking for a proof of concept study to do chemogenetic fMRI in your lab, I recommend you to take a look at the abstract that we had back in 2015. The abstract number is 1908. The first author is Manasmira Das. And at the time, we did a very simple experiment that we just take a 1 microliter virus of adenosine-associated virus serotype 5 with KMK2 alpha promoter encoding HM3DQ, inject that to the cortex, and after 4 weeks of expression, you should get a pretty decent expression pattern that look like this. And also with CNO dose around 1 milligram per kilogram, either through IP or IV, you should be able to activate this area as shown here. And the time course should be very different as compared to the control area or the control subjects. So this year in ISMRM, there's a oral presentation from the Gozi lab with, Monday morning, which they talked about the combination of DREAD and fMRI to look at the serotonin system. And also on Thursday afternoon, Manasmira Das from my lab will talk about her study to use chemogenetic fMRI and PET to examine a subpopulation of noradrenergic neurons. So just a short summary. Electrical DBS is a highly translational technique. It gives you high throughput and high fidelity neuromodulation. The potential weaknesses are safety concerns, susceptibility artifacts, and lack of specificity. With chemogenetics, now you can achieve cell type and projection specific manipulation similar to optogenetics, but then the difference is that this one gives you a prolonged control of activity with minimal invasiveness. The potential issues with chemogenetics is that you could get some receptor or ligand side effects, and also this is not suitable for block design because most of the time you only got one shot. And for this talk, I would like to thank Manasmira Das and Esteban Orazabal from my lab for a very useful discussion, and I'd like to thank you for your attention.